So, we see already what's going on here. The philosophy of Plato, Ezekiel Emanuel, Peter Singer, it's all there for us to see, isn't it? The older you get, your chances are attenuated. God forbid. So let's talk about one additional thing here. You remember the promises, if you like your doctor, you can keep him, and if you like your insurance, you can keep them. Well, unfortunately, the deck is stacked against you, isn't it? Because the way they've structured Obamacare, with the penalties and the individual mandates, the penalty is cheaper than the cost of insurance. You cannot be denied for pre-existing conditions. So why would you get insurance? Why would an employer buy your insurance? It's cheaper to pay your fine. And that's what will happen. As insurance goes higher and higher, because they've only allowed a certain type of plan, insurance plan, the cost of those plans will go up and up and up to the point where real people like you and I will not be able to afford those plans. So what is available to us? Oh, thank God, the government option is available to us. Thank God we can rely on the federal government to take care of us. And you know what that means, don't you? That means waiting for care. I have a radio program, Dr. Dan's Freedom Forum, and we have been discussing Obamacare. And the last 2 weeks, I happen to have as my guest a nurse, a British woman who was a registered nurse in Great Britain, and then emigrated to this country when she married an American, and became a registered nurse here. So she had a unique perspective. She was an RN in Great Britain under the National Health Service, and she was an RN here. And she could compare very directly what the differences were. She said the number one difference between the National Health Service in Great Britain and what we have here is waiting time, waiting lists. It's like when you go to the post office and there's one clerk there and the other three are back having a coffee break and there's a line going out the door. That's about what it's going to be like under Obamacare. There'll be waiting lists. In Great Britain, you have to have a primary care physician. There aren't really enough. So there's now a waiting list to get a primary care physician. Once you get a primary care physician, then you see him when he tells you you can be seen. Let's say you have a problem and you need a test. Well, you go on a waiting list to get the test. You get a card or a letter from the hospital where the test is done and say you will appear at the hospital at 10:30 in the morning on Wednesday to get the test. If you miss your appointment, you go back to the end of the waiting line. If you have a test or two done and you have a diagnosis in which you need to see a specialist, you go on another waiting list to see the specialist. That could be months long. If the specialist then says you need a procedure done, that could be months, sometimes over a year, to get procedures that are done here scheduled 2 or 3 days in advance, if needed. What does all that translate to? It translates to death. Because when you have a serious disease, God forbid cancer, and you're on a waiting list for 12 to 18 months, that's how you die. You die because diseases that are serious need to be taken care of in a timely and efficient manner. The British Health Service doesn't, and Obamacare will not either. We will be waiting in lines eternally to get the care that we now get when we need it from compassionate physicians. You know also that one of the main problems is the cost of care toward the end of life. Well, Great Britain has solved that problem. they've solved that problem by establishing what is called the death pathway. When the doctor or the healthcare service feels that you are on your way to death, you don't get any more care. Now, in this country we have hospice. Well, hospice has a time limit on it, doesn't it? A few weeks. The death pathway can be a year or more, in which you lie in your bed with a broken hip and your pain, numbed by narcotics or whatever they feel is necessary. So that's the kind of thing that we're looking at this country. So before I close, let me give you a small picture of what it could be like if we had a government that was interested in protecting individual rights and freedom. And that is called free market medical care. Because somehow, with true free market medical care, we all get the care we need. And there's ample examples of that all around us. First of all, people were not dying in the streets before Medicare. You would not drive in downtown Raleigh and find dozens of people lying on the sidewalk taking their last gasp of breath before they died. They were taken care of. The medical profession is a compassionate profession. I was born and raised a caregiver. So is Dr. Brandon. We have it bred into us to take care of people. My parents were both pediatric dentists. They practiced together for 50 years. They had Free Friday in their office every single year of their practice. If you had no money and your kid needed dental care, you called up, said, I don't have any money, and they were given an appointment on Friday. And they worked all day Friday and took care of patients for free. That was their giving back to their community where I grew up and where they practiced for 50 years. And all the other physicians did the same thing. The hospitals did the same thing. If you needed medical care and you didn't have money, the church helped you, your neighbors helped you, your friends helped you, your family helped you. But people were not lying in the streets of Raleigh dying for lack of care before the government came and said, I'm going to take care of them. The free market works. In my specialty, we have an excellent example of that, and that's LASIK eye surgery. When LASIK first came into being, it was only performed by very few surgeons, and it costs an awful lot of money. It cost as much as $3,500 an eye to have LASIK done. Well, now there's a lot of people doing LASIK surgery. It's available all over the country. Lasers are everywhere. You can get LASIK for $700, $800 an eye now. Why? One word: competition. Competition in the free market, when the government isn't around, gives you quality of care, availability, and a price you can afford. Under a free market system, you can go to a doctor and say, boy, I'd like you to examine me, how much it's going to cost. And he'd say, it's going to cost you $150. He'd say, oh, I don't want to spend $150. So you go next door to his competitor, and he says, I'll do it for $125. So you got the job. That's what the free market does. And we could have a free market system in this country if we had healthcare savings accounts for every individual. And I'm not talking about how they're funded. Obviously, some people may not be able to fund them as much, and there are ways of equalizing that a little bit more so that people who really couldn't afford it can have more money in their healthcare savings accounts. You can do that. But if you have a healthcare savings account, that money belongs to you. It doesn't belong to the government. It's not a Bernie Madoff pyramid scheme by which the government steals your money and gives it to other people. We need insurance companies able to compete for your business everywhere. I want Geico to be writing my healthcare insurance policy. I like that little guy, that little green guy. Maybe he can give me a better deal than I'm getting from my insurance carrier now. And he probably could if he was competing with every other insurance company in this country, so that we could have an insurance policy that was specific for my needs. Let's face it, Does your auto policy pay to change your wiper blades, your oil, and your oil filter? No. Does your homeowner's policy pay to clean out your gutters or paint your house? No. Those policies are catastrophic policies. If we had healthcare savings accounts for the everyday routine healthcare needs and catastrophic insurance policies, that would be a healthcare system that we would own. I want every one of us to own our own healthcare. You could also have high-risk insurance pools for people with serious illness. There's a lot of ways of doing it. But the free market is the key, not the government market. So, what is all of this going to do to us? I think you can see that it doesn't look good for us. Dr. Brand is going to talk about some of the remedies. And we need to exercise those remedies. Invariably, under Obamacare, the quality of care that we now have is going to be sacrificed. Sacrificed on the altar of cost effectiveness, and the patient is always going to be the victim. For me, how good Obamacare is can be answered by one simple question. If it is so good, why did Congress exempt itself? The answer should be obvious. So again, ultimately, we come down to the most important question, and that is, who owns your body? As of right now, the federal government owns your body. And that's something that we need to talk about seriously. Because when we don't own our own body, how can we say that we are free? Thank you very much.